Hello and welcome. You're watching Health and Wellness Save a Life. I'm Gargi Rawat. Heart disease is the leading cause of death worldwide, claiming an estimated 17.9 million lives each year. Up to 50% of all cardiac deaths due to cardiovascular disease occur in people who have no history or symptoms of heart disease. Cardiac emergencies can occur at any time and at any age. Even young adults suffer from sudden cardiac death due to their sedentary and stressful lifestyle. It has been proven that bystander CPR can improve the rate of survival by almost 50%, and CPR knowledge will equip you with the skill and the confidence needed to transform yourself from the role of a bystander to a lifesaver. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. And today we have with us eminent cardiologists who can help you understand sudden cardiac death and the role of CPR to revive and save a life. We're joined by Dr. D. Sunny Anand Nesan, a critical care consultant, interventional cardiologist, Anand Hospital, Chennai. Dr. Pradeep Kumar K, senior consultant and interventional cardiologist, Dr. Pradeep's Cardiac Care Center, Bengaluru. And Dr. Amitabh Yaduvanshi, a head of cardiology, Holy Family Hospital, Delhi. Thank you so much, doctors, for joining us on the program today on this very, very important issue. Dr. Sani, I'd like to start with you. Heart failure is a global pandemic and its prevalence is increasing day by day. What is heart failure, and if not treated on time, what problems can it cause?
Heart failure by definition, it's a complex clinical syndrome that results from a functional or structural heart disorder impairing the left ventricular filling of ejection of blood to the systemic circulation. In simple terms, you can tell it like it is failure to meet the demands of the circulation. So when you have already told about the prevalence worldwide of population would be around 64.34 million cases till now of heart failure, and if not treated in time, it can definitely decrease the functional capacity of the individual, and also it can lead to patients having chest pain, breathlessness, palpitations, syncopal attacks, and long-standing heart failure definitely leads to death of an individual.
All right, Dr. Kumar, is heart failure just a normal consequence of getting old? What are the most common conditions that can lead to heart failure?
That's an interesting question. There are a variety of changes that happens in the body with increasing age. For example, you might have noticed that even the best of the sports personnel find it difficult to maintain the same level of fitness and agility after 40 years of age. This is not something abnormal. It's just a part of aging process. Does this aging process affect the heart also? The answer is yes. With increasing age, the heart becomes stiffer. There are some wear and tear changes that happens on the valves of the heart, which may result in mild leakages. These are, however, not considered abnormal. But if these changes are exaggerated and result in significant narrowing or leakage of the valves, it can progress to heart failure. Also, increasing age is associated with conditions like diabetes, hypertension, coronary artery disease, all of which can predispose in an individual to develop heart failure. So the bottom line is, increasing age does not increase the risk of heart failure directly, but can be associated with numerous conditions which can predispose an individual for heart failure. Coming to the second part of the question, what are the important causes of heart failure? Firstly, heart attack and coronary artery disease, which can happen due to abrupt closure or gradual narrowing of the coronary arteries, can have potential to progress to heart failure. Other important causes of heart failure are valve abnormalities, which can result in narrowing or leakages, infections affecting the heart due to viruses like COVID, diabetes, hypertension, alcohol consumption, and a few genetic abnormalities can all result in heart failure.
Right. Dr. Yaduvanshi, can heart failure occur without knowing it? What are the signs and symptoms of heart failure?
We should understand that heart failure is a continuous process. It's a continuum of disease which can start from a stage where the patient is asymptomatic, or in fact even a stage further where the patient has risk factors for developing a heart failure. So patients who have coronary artery disease, who have hypertension, who have diabetes, they have risk factors of heart failure. and they may progress to heart failure. Then second stage occurs where the patient has some symptoms of heart failure or some symptoms that are not really attributed to heart failure. As you said, a patient can think, okay, it is all part of my normal aging. There might be fatigability, there might be some swelling in the legs, which the person can probably ignore or might ignore, thinking it's a natural aging process. And then there are episodes where the patient can go into overt heart failure, where there is breathlessness, there is swelling in the legs, and there is chest pain or other symptoms, which can then make the heart failure, which was incipient, obvious to the patient. And then those patients, and many of times, unfortunately, these symptoms are also not sometimes even by physicians not recognized properly and not really attributed to heart failure. Sometimes they are treated as asthma, and nebulization and other treatments are given. So only when a patient lands up in a much more worse stage that sometimes heart failure is diagnosed. So you can have asymptomatic heart failure or very mild symptoms during heart failure, and it is at that point of time where further deterioration can be prevented, and medical should be sought. Medical advice should be sought.
All right, Dr. Sunny, how is heart failure then diagnosed, and what can be done if a person is diagnosed with heart failure?
Yeah, heart failure is mainly diagnosed initially by symptoms and signs which the patient shows us. Symptoms being the commonest cardiac symptoms like chest pain, left-sided chest pain, compressive chest pain, in where patient has breathing difficulty, sweating occurs, patient is having breathing difficulty along with palpitations, a dry cough is present, along with that is inability to sleep, lie flat or sleep during the night. Right? He wakes up during with the breathlessness, and also has on and off syncopal attacks and lightheadedness. The signs being he will definitely a heart failure patient and will present to you with swelling in the both ankles and legs, or increased heart rate, heart is pounding, or he is able to perceive this heart rate in a higher rate rather than a normal one. Then he unusually notices distension of veins in the neck, and also his abdomen is bloated, or it is he has bloating sensation of abdomen. Investigative part is definitely to diagnose heart failure would be the primary investigations at ECG and echocardiogram, along with blood investigations like cardiac biomarkers as like troponin, CK, MB, and even a brain natriuretic peptide, that is BNP. If a person is diagnosed with heart failure, he has to definitely consult a cardiologist, and definitely lifestyle modifications has to be done. So the advice would be he should avoid alcohol and or limit alcohol intake, avoid salt intake, smoking, and also he should stay active, and he should get good sleep. That is at least 6 to 8 hours of sleep should be taken by the patient. He should take the prescribed medicines by the cardiologist and review with him periodically to have a better quality of life. Thank you.
Right. Dr. Kumar, are there different types of heart failure, and what are the treatment options for heart failure?
Yes. The heart pumps blood to the entire body. It does this by contraction and relaxation. The contraction of the heart is called systole, and the relaxation of the heart is called diastole. Abnormalities in the contractions of the heart will result in reduced pumping of the heart. This is considered as systolic heart failure. Whereas abnormalities in the relaxation process of the heart can impair filling of the blood into the heart, and this is considered as diastolic heart failure. This is one way of classifying heart failure. Whenever we use the term heart failure, by default, we are referring to the left side of the heart or the left ventricle. But we do understand that the right half of the heart is also equally important because it carries deoxygenated blood to the lungs for oxygenation. There are certain conditions which involve the right-sided chambers, right-sided valves, and any long-term abnormalities in the lungs or increased pressure in the blood vessels of the lungs. All these things can preferentially affect only the right side of the heart. This condition is called right heart failure or right ventricular failure. Sometimes patients with heart failure may present with severe symptoms of shortness of breath, low oxygen levels, and abrupt onset and rapid progression. This often requires hospitalization and ICU care. This condition is described as acute heart failure, whereas most of the times patient will have protracted or prolonged symptoms which wax and wane over a period of time. This is considered as chronic heart failure. So by now we are aware of the terms called systolic heart failure, diastolic heart failure, left heart failure, right heart failure, acute heart failure, and chronic heart failure. Coming to the second question on treatment options in heart failure. Heart failure is a complex syndrome which requires comprehensive treatment and continued medical care. So lifestyle changes are extremely important. Intake of fluids and salt has to be restricted. Body weight and limb swelling or the foot swelling has to be regularly monitored. Tailor-made mild exercises can be advised. There are a variety of medications which effectively work in a multi-pronged fashion to relieve the symptoms, prevent the progression of heart failure, and favorably remodel the heart in a way that they improve the long-term outcomes. If the patient has refractory symptoms and rhythm disturbances, certain devices like cardiac resynchronization therapy or implantable cardiac defibrillator can be implanted in these patients to improve the outcomes. In selected patients, ventricular assisted device, artificial heart, and cardiac transplantation also can be considered.
All right. Dr. Yaduvanshi, what heart healthy changes should a person then consider making if he or she has heart failure?
So as I told you earlier, heart failure is a continuum. So when we start, so the treatment also starts from the beginning only. In fact, prevention is better than cure. So how to prevent heart failure? So how to prevent a person from developing a heart failure? So important things is all those conditions that lead to heart failure should be treated properly. So diabetes has to be treated properly. Your hypertension has to be properly controlled. If there is coronary artery disease, then appropriate treatment has to be done. If angioplasty or stenting is required, that should be done. If some other surgical intervention is required, that should be done, because that is the way where you prevent the heart muscle from getting damaged. Because once the heart muscle gets damaged because of coronary artery disease or any other factors, once the muscles are damaged, then you are doing firefighting only. You are trying to save the muscle as much as possible, but damage has already been done. So primordial prevention or prevention is more important. Secondly, if you develop symptoms of heart failure, then there are certain things that needs to be taken into care. Your baseline condition has to be controlled. Salt intake has to be restricted. Fluid intake has to be restricted depending on your condition. So the doctor will advise you, but certain things are generally advisable in a patient with heart failure is they should not take extra fluids. So there is a concept in our country or everywhere that juices and coconut water and all those things are more healthy, and most of the patient who is any patient who is sick are given juices and all. That is not proper for a heart patient or a heart failure patient. So fluid should be restricted, salt intake should be restricted. All medications, there are now very good medications that are available for management of heart failure patients. There are 4 or 5 group of drugs that should be on board in any patient of heart failure, and regular medicine intake is probably the most important aspect of your lifestyle modification that you can do once you have developed heart failure. Prior to that, other lifestyle modifications help, but once a person has symptoms of heart failure or has diagnosed heart failure, then medical management and adherence to medicine is very important, and regular checkups, regular monitoring of your condition. Another factor that we tell the patient is to measure their weight properly every day. If there is an increase in weight for say between 2 days or 3 days, you find that your weight has increased by 1 kilogram or 1.5 kilogram, that means your body is retaining fluid. That means you have to make sure that your fluid intake is less, your salt intake is less, and you might have to consult your doctors and they might increase the medications that you are on. So all these things have to be taken care of once you are diagnosed as heart failure patient.
All right, very important to keep all that in mind. We have a lot more questions for our doctors, but for the moment we'll slip into a short break and return with more. Stay with us. Welcome back. You're watching Health and Wellness. I'm Gargi Rawat. Let's go back to our doctors and with our questions about heart health. Now, Dr. Sunny, can heart failure occur in young people and can it cause sudden cardiac death in young people?
Definitely. The young individuals, especially Indian type subset of patients, tend to have heart failure at an earlier age. It is occurring in young individuals, and also when we compare with the Western population, Indian subset of patients, are definitely younger. And those patients who come to you with, even a breathing difficulty or chest pain or any other cardiac health symptom, it is better to assess the patient and also do the primary investigations and diagnose them at an early stage rather than and no leaving it to be only doing a symptomatic treatment won't help. In the initial phase of the heart failure itself, you are going to treat the patient. Then the progressive disorder of the heart failure, you will be able to at least prolong the quality of the life of the patient to a betterment. And when you see the prognosis compared to the West, the prognosis is worse in Indian subset of patients. And less than 35 years of individuals itself are getting diagnosed of heart failure. And even within 5 years period or even 1 year period, the mortality rates are higher when you compare Indian patients. So a patient goes into heart failure, it is definitely is going in like for a deathbed. Is going into a continuum of no diseases, and the associated diseases and associated conditions definitely is going to worsen the individual and also his quality of life when it is young and diagnosed individual with a heart failure. And those patients, heart failure with low cardiac output would be the commonest cause for sudden cardiac death in younger individuals. And when we take the mortality rates itself, when you take any mortality rate for in cardiovascular disease, is heart failure be a leading one, and it is to be prevented and treated at the early as possible. Thank you.
All right, Dr. Kumar, now we've been talking about heart health and, heart failure, etc. But lack of CPR awareness is a huge challenge in India. So let's focus on that. If you could tell our viewers about what are the main steps of CPR.
Yes. So I'd like to introduce about a term called cardiac arrest. Cardiac arrest is a condition where the heart abruptly stops pumping blood. It can happen due to various reasons, including the ones cause for sudden cardiac death in patients with heart failure. Following a cardiac arrest, the patient becomes unresponsive within a few seconds and the pulse cannot be felt. In the next few minutes, the patient will be gasping for breath and the damage to vital organs like brains begins. If there is no help offered in the next few minutes, the patient is going to soon lose his life. This situation may arise to anybody around you, including your friends or family members. In this situation, the single most important life-saving intervention that can save the person, that can be offered to the patient, is cardiopulmonary resuscitation or CPR. Hence, CPR awareness and training should be made mandatory to all citizens of our country. But we need to understand a few things about CPR. Firstly, if a patient is unresponsive and unconscious, apart from cardiac arrest, there can be other causes for this. Like it may be stroke, it may be seizures, very low blood sugars or very high blood sugars can cause unconsciousness. Choking can cause unconsciousness. In most of these situations, the pulse will still be felt and CPR need not be started in these patients. The best we can do is shift this patient to the nearest hospital at the earliest. But if the patient's pulse is not felt, then it is possibly due to, and is unconscious, it's possibly due to cardiac arrest only. So the rule is that CPR should be started immediately only when the patient is unresponsive and pulse is absent. Secondly, we must understand that CPR is not a definitive treatment. It just helps us to keep the patient alive while seeking appropriate medical help. So seeking medical help at the earliest should be given topmost priority. Thirdly, a wrongly done CPR can be of little help. In fact, it can cause more harm to the patient. So learning the proper technique of CPR is also important. With this background, I would like to give some practical steps. I would like to inform about some practical steps of performing CPR. If a patient is found unresponsive, we should lift both his shoulders and call him out loudly and confirm that he is unresponsive. We should also check if he is breathing and feel for his pulse. All these needs to be done in about 15 to 20 seconds. If the pulse is absent, we have to shout for help and immediately start off chest compressions. Chest compressions must be given over the lower half of the chest in the central part with interlocked hands at a rate of about 100 to 120 times per minute. It should not be too rapid, it should not be too slow also. The chest compression must be firm and it has to attain a depth of about 5 to 6 centimeters. And most important is, after every compression, we will have to adequately withdraw our hands and recoil also, because this gives time for the chest to relax. This compression and recoiling sequence is very important for an effective CPR. If there is a second person around, they can help in making it easy for the patient to breathe by tilting the head and lifting the chin. This makes it easier for the person to breathe. After every 30 chest compressions, 2 mouth-to-mouth breathings can be offered. But if this is not possible, or if the person who is performing CPR is not willing to give mouth-to-mouth breathing, it's all right. We can just continue with the chest compressions. But every 2 to 3 minutes once, the bystanders can take turns and perform CPR. Uninterrupted and effective CPR needs to be continued till medical help arrives. If properly performed, CPR can be life-saving on many occasions.
All right, and finally, Dr. Yaduvanshi, what if the person has an ICD or a pacemaker and they have a cardiac arrest? Can we perform CPR on such patients?
Yeah, definitely. Any patient who is, as Dr. Saab said, unresponsive, your pulse is, you cannot feel the pulse, then these patients require CPR. Whether they have a ICD or a pacemaker inside doesn't really make a difference. The ICD is actually put because to prevent such type of a situation where the patient collapse and have CPR. But then again, ICDs are not 100% preventive. So some patients with ICD, because of various reasons, may still have a cardiac arrest, and they would require a CPR and resuscitative efforts, just like any other person. There are certain things that needs to be taken into care, but I think that is beyond the scope of this talk. I think for a lay person, for a bystander, they should start CPR as soon as possible. And as Dr. Saab said, chest compression only CPRs are also very good. So if breathing, there is a challenge of giving mouth-to-mouth breathing, chest only CPR is also important. Another thing that I would like to mention is at many places like malls and bigger centers, bigger hotels and all, you may have seen an automated external defibrillator or an AED. So as Dr. Saab said earlier, that BLS training or basic life support training should be mandatory for everybody. Similarly, people who are in these type of areas like malls, so the guards, the managers, the gym instructors, they should also be aware of CPR as well as AEDs, because AEDs are, I've seen available at so many centers in our country, but most people do not know how to use it.
Right, a very important point there, Doctor. Thank you so much all for joining us on the program and answering all our questions on this very important issue. Thank you all for watching at home. Time for us to slip into a short break. Do stay on with us on NDTV.